You able to see the screen? Okay, I see a head nod. Okay, good morning. Thank you, everyone. Thank you, Rhonda. Thank you, Minnesota Coalition for the Homelessness, for your advocacy and for convening us together, albeit virtually. I think it's so important for us to be together in community and to be together to continue learning and about homelessness and how to best serve the people in our community to be stable. So thank you for your participation. I know everyone's working really hard, so to carve out a little time in your day is really a gift, and a personal thank you for giving me a great excuse to get out of sweatpants. So, and if you're in sweatpants, that's great. Just get comfy and engage in this conversation with us. So again, welcome. Thank you for having us. My name is Erin Menne. I am a program grants manager at Minnesota Housing. I oversee the Minnesota Housing Trust Fund Rental Assistance Program. I work as part of the staff on the Homework Starts with Home program, as well as oversee the HPAP Housing Opportunities for Persons with AIDS Greater Minnesota grant. And I'm gonna hand it off to my colleagues to introduce themselves. Maybe we'll start with Ellie because I see her face.
Good morning, everybody. My name is Ellie Miller. I'm also a program and grants manager for Minnesota Housing. I oversee programs that assist people with disabilities. There are two programs. One is Bridges Rental Assistance, and the other is Section 811. Today, I'm going to be highlighting Bridges in our presentation.
Nancy, can we go to you next?
Sure. Good morning, everyone. My name is Nancy Urbanski, and I work alongside with these three ladies who are presenting with me. And I work primarily in the Family Homeless Prevention and Assistance Program, the Homework Starts with Home program, which is the program that I'll be highlighting today, the Landlord Risk Mitigation Fund pilot, as well as the COVID-19 Housing Assistance Program.
And Diane. Thank you, Nancy.
I tried to put myself on camera just briefly because I can't usually talk and do camera at the same time with my bandwidth. But my name is Diane Elias, and I work at Minnesota Housing as a program manager, helping to manage the Family Homeless Prevention and Assistance Program, the Homework Starts with Home program, Landlord Risk Mitigation Program, along with Nancy Urbanski, as well as the COVID-19 Housing Assistance Program, which is the one that was referenced in the Lieutenant Governor's video that's currently assisting households during the pandemic and ends on December 30th.
Thank you. So who we are at Minnesota Housing. Minnesota Housing's mission is to provide access to safe, decent, affordable housing and build stronger communities across the state by offering products and services to help Minnesotans buy and fix up their homes, stabilize neighborhoods, communities, and families. Minnesota Housing also supports the development and preservation of affordable rental housing through both the financing and long-term asset management of projects and developments. The agency has also pioneered a successful model for supportive housing that helps stabilize the lives of some of the state's most vulnerable citizens. So our full name is Minnesota Housing Finance Agency. There's one in each state, and as the finance piece implies, we are essentially a bank with our only lending products being affordable housing. So we fund multifamily affordable developments as well as single family homes. And on the single family side, some of the products and services we offer are first-time homebuyer assistance, homebuyer education, some down payment assistance, as well as some fix-up funds. And on the multi-family affordable development side, a large chunk of our portfolio is for permanent supportive housing. And because we are a bank, we generate funds, and those funds go back into our mission-related work, which is kind of where we live, the four of us in the housing stability team. So our work with our grant programs is really to provide some services and some additional rental stability to the housing finance, affordable housing market in the state. So that's kind of where we're situated. And so let me see. So what we're going to talk about today is each of my colleagues is going to take one of the programs listed here to really give a broad general overview, and we'll pause at each of the programs to see if there's any program specific questions that you have. But we also want to, after the program overviews, we want to take a chunk of the time, we want to take advantage of our time together. So we've really allocated a good chunk of our time together to get your feedback on our grant program. So what could they and should they look like moving forward? So be that different priorities or targeting, are there different changes to rules or statutes that would really help make our programs better utilized or more easily implemented? Is there better coordinating that could be done across state or federal programs? Or is there something with the request for proposal structure that could be streamlined and more accessible to a broader array of applicants? So I wanted to plant that seed for future discussion, because we already have learned from COVID that government can do things faster and differently than we ever dreamed possible. And I can attest that there have been years of conversation around just that, the streamlining, how can we make programs better, how can we have better outcomes, and how can we have implement more equity into our grant making and programs in general. And with COVID and with the uprising following George Floyd's murder, this has really cemented the urgency of now and really brought it into focus for us. So we want to acknowledge that we need to engage broadly in order to move forward and move in the right direction with our programming to be nimble and responsive to the needs. So again, wanted to plant that seed for future conversation, and we'll use the technology that we can to engage. So wanting to have you get an extra cup of coffee and really be energized for an engaging conversation with us. So thank you again. And we want to know who you are. So MCH, please launch our first poll. I'm not sure how this piece works, but there should be a pop-up of who you are. Oh, here it is. So do you have experience working directly with any of the Minnesota Housing Grant programs? Cool. This is kind of fun. Oh, we have quite a few of our current grantees participating. That's awesome. Okay, so 40% current grantees, a lot of folks who are wanting to know about the programs for referral and other. Okay, I should have offered more options. I'm curious now. All right, well, again, thank you for participating, and we'll move on to the programs. So Diane, I think you're up first.
Sounds good. Erin, I think I might have been one of the others. I just participated to see how the poll was working. So I'm really excited to talk to you today about our program, and just kind of echoing some of the information that Erin shared about our agency. You know, we're a very small team on the housing stability team. There's about 10 of us. And we're working together on these programs that very much impact what our agency is trying to accomplish. With the large part of our agency being involved in both single family mortgages and multifamily development, we're really trying to make sure that there's enough affordable housing. And of course, the number of units of housing needed far outweighs the funding that we're currently receiving. But to be able to make an impact on reducing the number of households that are needing housing is a huge thing that we want to focus on. And so even though we're a small team, we're a very mighty team, trying to make sure that we have the resources available to prevent additional need for the affordable units by keeping people in the housing that they have, and doing that through a combination of rent assistance programs as well as services. And so FHPAP combines both services and rent assistance and tries to do, in some ways, a continuum of services, focusing on the prevention end to keep people in housing, as well as assisting households who are homeless to get back into housing as quickly as possible. So next slide. So this program was established in 1993 by the Minnesota legislature. We do now have more than 20 million available statewide. This program funds on a biannual basis, and so the funding comes every 2 years. So it's about $10 million per year, and it helps anywhere from 10 to 12,000 households over the 2-year period. The statute also outlined a very unique area for this particular funding, which is that each entity receiving the funds must have an advisory committee. And the advisory committee is made up of folks who are advocates or community members or landlords, maybe public safety, counties, schools, and anyone that's interested in being able to address the prevention side of homelessness or early intervention. These committees across the state sort of act as a homeless response system or a community response. And what's fantastic about these groups is that in addition to managing the FHPAP funding, they've also been able to delve into other areas. So as opportunities came forward, for example, during the housing crisis back in 2008, there were some HUD funds that came out to address that crisis. And a lot of FHPAP committees took the initiative to figure out how they could apply for those funds and respond to their community. And I think very similarly, those FHPAP committees were involved during the planning prior to the pandemic and then into the pandemic for how they could respond to what was happening in our community. And I think that made a huge difference in our own planning at the state on how we responded once we received the $100 million. So the advisory committee is just a really key piece, and I don't want to sell that short as part of the resources available to this program. Next slide. So we have a number of outcomes for this program, and we tried to coordinate these also with outcomes that are required by HUD, and also so like through the continuum of care, and then also through other programs such as the Office of Economic Opportunity and other state agencies that are working on homelessness. And we really, as I mentioned, this program does span both the prevention side and into the homeless side. So we are able to have outcomes that are impacting the goals at the state level, and with the state goals being that homelessness is rare, brief, and not reoccurring, we were able to tie our outcomes to that as well. And then a piece that's just been really important to us is to make sure that we are infusing the work related to increasing equity into our work. And so we do have a very distinct outcome for that as well, so that we're making sure that we're consistently measuring our programs against that equity goal. Next slide. So to be eligible, you really just need to be a household in Minnesota, whether it's a family, individual, youth. It's really all populations that are eligible. The household income must be at 200% of the federal poverty guidelines or below. And then the household needs to be at imminent risk of homelessness and not able to pay for whatever the crisis is. Next slide. So there's a number of expenses that are eligible under FHPAP. And as I mentioned, this is one of the programs that we have that has both a service component and an assistance, like a direct assistance component. So the support services are what can be utilized to pay for staff to help these households access resources, mainstream resources, employment, helping to resolve the crisis, do the housing navigation, help them look for housing. And that's been a really key part of this program. We also pay for some administration costs. That's up to 10% of the grant. And then we use the remaining dollars for direct assistance and can be used on a number of housing related costs. It's fairly flexible funding, which I think our grant administrators appreciate. And can be used for anything that's going to resolve that housing crisis, such as rent, utilities, getting a deposit to be able to move into a house, and other types of costs that are impacting that crisis. Next slide. And so for more information, you can go to our website. There are a number of things on the website, including, the program guide and information about our grant. Once we put out an RFP, all the information about the RFP is shared there as well. And then we also have a list of administrators that you can see on our website where clients can contact those folks to ask for assistance. So just making sure that you have that website as well. All right, Erin. Any questions so far about FHPAP?
Oh, teammates, I lied about being able to navigate questions because with sharing the presentation, I can't see them. So I don't know if there's any questions in the queue. And also, which there might not be, maybe that's, oh, I do see that I have that. So maybe, thanks.
Yeah.
Maybe you just don't have it. So inviting folks to use the Q&A feature, and we will be able to, either type responses as folks are speaking, or we can ask them live. Do not see any at this time. So.
All right. And we'll have more time for questions at the end of the presentation as well. So we absolutely can answer them at that time also.
Okay, switching gears then to rent assistance programs, and we'll start with Bridges.
Thanks, Erin. Bridges rental assistance is going to be paired with Housing Trust Fund today as two examples of rental assistance programs that have been longstanding at Minnesota Housing. The first thing I want to highlight is, the basic overview of what Bridges is, but I also want to just indicate that we're doing a lot of work on these programs currently. And it's good timing to actually be in front of people who are familiar with the programs and interested potentially in becoming providers. Bridges is going to be having an RFP coming up. Announcements will come out in the spring. So if you are in an organization that's interested in becoming a provider, it's a good time to reach out directly to me, and we will get you more information on what it takes to become a provider. But it's good timing to get this in front of people, and I encourage people to reach out. So the basic overview: Minnesota Housing provides Bridges funding statewide, and typically we fund housing authorities, but we also fund tribal nations and community-based nonprofit organizations. The funds are released across the state in a competitive RFP process. And again, our process is coming up in the spring, so look for announcements. There are 2-year contracts that we administer for Bridges, and the next one will start July 1, 2021 and finish up June 30, 2023. And again, if you are a provider that is interested in working with people with disabilities and interested in learning more about Bridges, please reach out directly to me. You'll have my information through either the Q&A at the end or through the organizer of the presentation, excuse me. So Bridges currently has a little over $11 million available for providers. And we receive our funding from two sources. One is the Minnesota legislature and the other is the Department of Human Services. And the amount that we have each contract term varies depending on the legislature. For example, in a couple legislative sessions ago, Bridges actually received a $500,000 increase in base. So going into this next RFP, we're going to be adding an additional $1 million on to the 11 million that's currently available. So as I mentioned, it's a great time for providers that are interested in this resource to get in, learn now about how to become a provider, and so that you can be a part of that competitive process in the spring. Next slide. To be eligible to receive Bridges, the head of household needs to be 18 and have a diagnosed mental illness. During the course of the program, that household needs to become eligible for a housing choice voucher or other permanent subsidy. And the gross income of the household at the time of initial eligibility needs to be at or below 50% of the area median income. Next slide. Bridges has priority populations, which makes it a little bit different than other rental assistance programs. The first priority population that Bridges serves are people exiting institutions. Most of the rental assistance programs that Minnesota Housing administers has a real strong focus on people that are homeless or experiencing sort of a risk of homelessness, where Bridges has a real strong priority of people exiting institutions or other segregated settings. There's been a little bit of conversation about the equity work that Minnesota Housing is doing, and Bridges is focused in on expanding this priority population. The institution definition for this next contract term will be expanded to include correctional facilities and people on supervised release, which will open up the population that's served in institutions greatly for this program. So we're looking forward to that. The second priority population is people experiencing homelessness or at imminent risk of homelessness. And that definition will also be changed a bit in the next contract term to high priority homeless, just to be more consistent with other state homeless language as it changes over the years. Next slide. In the priority populations, one of the biggest priorities is the regional treatment centers that are positioned around the state. We receive additional funding from the Department of Human Services to service people exiting the regional treatment centers. And all Bridges funding can be used for these institutions, but the strong focus coming out of the Department of Human Services has created a strong network of providers that receive these referrals and able to place them in housing. And that'll be a continued focus in the next contract term as well. Next slide. So eligible uses is another area of equity work that we're expanding for Bridges. Bridges cannot be used for service-related expenses. It's for rental assistance-related expenses only. But we're expanding what kind of rental assistance we can provide. So it's the typical funds that you see, the direct payment to the landlord for the subsidy portion, security deposit, application fees. We do also do direct payments to landlords when people leave the unit for medical or psychiatric crisis. And then we provide an administration fee to the providers that are providing this rental assistance. But the expansion is really taking a look at what else can we make eligible underneath statute, so that providers really have all the resources they need to be working with people with barriers to housing and expand that landlord pool. So example, double damage deposits will become an allowable expense. Vacancy payments, maybe for longer terms or for any reason that somebody may need to exit the household. And then we're also looking at, the navigation funds and mitigation funds that have been available through Minnesota Housing, but not necessarily for bridges providers specifically. So more to come on that, sort of an expansion of eligible uses. Next slide. So because bridges rental assistance just covers the rental assistance and not the service components, there's an expectation for bridges providers to have strong links to their mental health initiatives and also to the service providers that provide culturally specific services for people with disabilities. So when a bridges organization comes in for funding, they have to have a cooperative agreement with their local mental health initiative and show strong ties and resources to the providers in the area to make sure that the program works the way that it should. Over the years, we've attended the mental health initiative meetings, and each region is really different in the resources that they have to provide the services. So in this next contract round, we've worked with the Department of Human Services, and we really hope to also have an RFP for the service resources for areas that are deficient in those services, so that when we launch bridges in the area, we really have a robust system of care for people with disabilities. Next slide. More information on bridges is on our website, and this will be updated in the spring to include information for the upcoming RFP. And again, if you're an organization interested in applying, please reach out to me directly. And I'll turn it back over to you, Erin.
Thanks, Ellie. I see that I skipped the slide for questions, but we are going to pause here to see if there's any questions specific to bridges. Oh, we do have one. When is the proposed expansion of bridges? Will there be an increased funding connected to the expansion?
Yeah, so the expansion will be for the next RFP round. Announcements will be early in the spring for applications due in April or May of 2021. And 2 legislative sessions ago, we received a base increase of $500,000. So now 2 sessions later, we have an additional $1 million to add to the base funding. So it's an excellent time as a new provider or a provider that's interested in expanding their service area to come into the RFP.
Oh, we're getting questions. Okay, people are getting warmed up. Can people who do not have documentation receive bridges?
Yes.
Okay. What is the application intake process?
So application for providers is through the competitive RFP, and announcements will come out early in the spring. And it's a competitive application that the organization completes. It requires a partnership with the mental health initiative or other service partners in the area. And the application is submitted and then scored and ranked with other competition, other competitors coming in for the round. And then decisions are made in June for funding July 1, 2021.
Thank you. One more question at this point. This person is wanting to hear more about a specific example of a bridges partnership with a housing authority in the state.
Okay. Well, there are many housing authorities across the state, and they identify a service region, and then their partner would be with the mental health initiative that also services the region. There's a full map of the mental health initiatives across the state. So they pair the housing authority sort of region of service with the mental health region, and that's the primary partnership. Within the mental health initiative are all the service providers that have resources in the area. So, any housing authority, including the larger housing authorities, will have a mental health initiative partner. And if you go to our website, you can see the map of the mental health initiatives, as well as all of the housing authorities across the state that have this funding. And there's examples everywhere across the state. So Jeff, I see you have the question. If you're really looking to a specific region and trying to find out more about a region and who the partners are, I'd be happy to answer that question offline.
Thank you. I don't see any more questions at this time, but keep them coming, y'all. Thanks. Okay, my turn. So Ellie's gets to be our trailblazer because the Bridges program has an RFP that is earlier than the rest of a lot of our programs. So thank her for her advocacy and pushing to expand and be more inclusive and engaging in her programming. So I'm going to share with you about the Housing Trust Fund. The Housing Trust Fund was established by the Minnesota legislature in 1988 and was expanded to provide operating subsidy and rental assistance in 2002. In 2005, the Housing Trust Fund rules were modified to add a funding priority for programs and developments serving households experiencing long-term homelessness. Housing Trust Fund currently provides funding to 39 grantees statewide, including nonprofits, tribal organizations, and housing authorities serving 70 counties and 7 tribal nations. It is about $26 million per biennium, so every 2 years. That's our funding availability. So Housing Trust Fund offers temporary housing subsidies for persons with histories of homelessness and barriers to accessing and maintaining housing. And we say temporary very broadly. That's a maximum of 5 years. And most folks are able to, either move on to afford housing on their own or qualify for a permanent subsidy. And we have exceptions, there we go, exceptions for persons, exceptions to that 60-month max for persons who are on waiting lists for permanent rent assistance, or those who cannot apply for permanent rent assistance because the waiting list is closed, or if they're ineligible for federal rent assistance. Rent assistance is combined with supportive services to increase housing stability, and the households pay 30% of their income towards rent. So the maximum subsidy is the difference between the 30% of gross income and the local payment standard. So it's similar to Section 8 or Housing Choice Voucher, but it's a little more targeted and a little more flexible than Housing Choice Voucher. And that flexibility piece of the Housing Trust Fund rental assistance can be used for programs to focus on different populations depending on the region. So it could be, like Ellie mentioned, there could be folks who are corrections involved for reentry programs, as well as targeting families and individuals. And as we'll discuss in the next program, Homework Starts with Home, we use some Housing Trust Fund to target families and students identified as homeless within the school system. So eligible recipients of Housing Trust Fund rental vouchers need to be 60% of the area median income, with a priority at 30% area median income. But we are asking for all of the Housing Trust Fund rent assistance to be accessed through coordinated entry, with the requirement that persons served meet the high priority homeless eligibility criteria for each local community. And what Housing Trust Fund Direct Assistance provides, of course, the rental assistance. But beyond that, we also do support the security deposit, the rent assistance application fees, utility connection fees. Every once in a while, we pay for some damage to a unit if that keeps your landlord relationships intact. And we have experimented a little bit with other different uses of the funds, including some housing navigation funds that we piloted this last round. That's the down and dirty of Housing Trust Fund. We have a link here to learn more about who our administrators are. For referral, you can contact your local continuum of care to find the access point for coordinated entry. Again, we're always accepting questions, so you can email us this rental assistance email, and then I'll open it up for questions. I should give the disclaimer that I'm 5 months into this role, so you might stump me, but that's good. That's a good learning opportunity for me. And I am highly malleable, so I love to have your engaging questions and ponder the future of the program. Oh, I see one. Will you continue doing housing navigation? That is a good question. We are just a year into it, and I think that as you all probably know very well, that there's a lot of things that have changed because of COVID and funding that had to be prioritized. So we're analyzing the utilization and getting feedback from the few administrators that did receive it about how effective it has been in actually getting units secured. And how many households does HTF currently provide subsidy to? That is a good question. It varies based on utilization. I believe it's over 300. I don't know. That's something I should know. I will get back to you, Jeff, on that. And it varies a lot depending on utilization. And I know right now, especially with the eviction moratorium, it's hard to get people in the door. So there's probably a lower count right now than we typically have in our program. Question, do you feel the program could or should get a funding increase? I think there is a powerful statement in that housing ends homelessness. So yes, I think having a rental subsidy is what's needed across the state. I think that the challenge of Housing Trust Fund right now is just the market right now and affordability to even with a voucher. Let me see, I think that is the questions. Are per capita payments for tribal members counted as income?
So Erin, on per cap payments, there are two different rules, so to speak, related to them. And so it depends on what has been negotiated. And that's why I'm very careful about answering that question, because depending on the parameters of the per cap, it sometimes is not counted toward income. So would have to know more of the detail before we can answer that question. The majority of per caps are counted as income, but we know that there are some in some tribal nations where the negotiation between the federal government and the tribal nation has made it possible for it not to be counted as income, because it's technically reparation instead.
Thank you, Diane. And it looks, since you're on, Diane, looks like there's an FHPAP specific question. Are FHPAP funds available all across the state? Is there a list of organizations that provide FHPAP funds to individuals and families?
Yes, there is. So we do have 20 grantees statewide, and it covers all areas of the state and a lot of tribal nations in the northern area. And then we have a list of those administrators on our website as well. So in addition to the list that is on the link that I presented in the slide of the folks that you can contact directly for assistance. There's also a list of grant administrators. And the difference is that the grant administrators are the original applicants that applied for the funding. And the list might actually contain sub-grantees of those grant administrators as well. So it's a broader list of like, where is the door, versus the grant administrator would be the one that's in charge of the funding.
And I believe it's a follow-up question. Can we refer clients directly? Or did you just answer that?
Yes. So on the list that's for clients, I think it's something like client called contacts for client referral. That particular list, you can refer clients directly. In some cases on that list, you'll see that it's the phone number for the agency itself. And in other situations, you might see a phone number for the continuum of care coordinated entry door. So depending on if that administrator is providing funds for prevention, that's usually a direct contact to the agency. But in some cases with homelessness, it would be the coordinated entry door that you would contact. So that's hopefully listed clearly on that contact sheet.
Diane. Okay, I don't see any more questions in our hopper, so we will move next to our final grant program. Homework starts with home. Nancy.
Hi again, everybody. I do have that I'm on video, but I'm not seeing myself on the screen. So if you're unable to see me, I apologize. But I will take a few minutes and review the Homework Starts with Home program. Next slide, please, Erin. So Homework Starts with Home began as a rental assistance pilot program in 2014, although under a different name. And it was for homeless and highly mobile families with school-aged children. And then in 2018, an interagency collaboration was formed and the Homework Starts with Home initiative was created. In 2019, the legislature appropriated funding for an established program, and we issued a round of funding for that program in August. So currently the program serves homeless and unstably housed families with school-aged children that are aged pre-K through grade 12, and then also youth, including youth with children or without children who are without parents or guardians that are also through grade 12. In 2018, student homelessness had been increasing at an alarming rate. And at that time, it was increasing an average of 13% a year in the previous decade. And in the last 2 years, school-based studies and the recent point in time count indicate that family homelessness has been decreasing. So that's very good news. And with this program, we hope to contribute towards maintaining or accelerating this trajectory going forward. Next slide, please, Erin. So at the core of this program is the philosophy that it takes a village, and as such, this program's administrated as a collaborative between local participating governments, schools, and nonprofit organizations that work very closely together. And it also requires implementation or movement towards implementation of a preliminary practice model. And that encompasses 8 elements, which include, some of those include nothing without us, about us without us. So essentially incorporating feedback of persons with lived experience, both in the program development and planning, as well as implementation of the program. And then other elements include things such as equity and continuous improvement. We currently have overlapping funding and two overlapping grants. So the first one that was issued in 2018 encompassed 3 types of funding, which includes philanthropic, and HTF, and then FHPAP. And that program will sunset, that grant will expire in 2021. And then with our second round of funding and any funding rounds going forward will be funds utilizing the legislative appropriation. And so those funds include FHPAP, and Housing Trust Fund. And so as such, we we call this program internally the beloved stepchild because it encompasses both FHPAP and HTF. And so we provide both rental assistance, short-term and longer-term, and also FHPAP is primarily used for support services, and then also HTF is for some of the expenses that Erin covered: rental assistance, some damage deposits, utility assistance, and then administrative fees. Next slide, please. So the outcomes for this program are, oops, oh, sorry. I'm on the wrong one. I'm using my screen, I apologize. So at a minimum, I spoke a little bit about this collaboration. And so it requires a minimum of a lead applicant which must be either an HTF or an FHPAP administrator, partnerships with eligible schools, and within those schools, there must be a minimum of 25 homeless students identified using Minnesota Department of Education data, and then a participating local government entity responsible for mainstream human resources and economic assistance programs. Next slide, please. The intended outcomes are, similar to FHPAP. We want to prevent homelessness, and if it does occur, that it's rare, brief, and non-recurring. And then one additional outcome is improving school attendance and academic achievement among homeless students. One thing that we learned between the 2018 issuing of funding and now is, going back to 2018, while there was some service funding available, we realized there wasn't nearly enough. We had approximately 8 times the request for FHPAP, which encompasses the primary source of service funding, than what was currently available. And so with the 2020 RFP and with the legislative appropriation, it wasn't defined how much went towards HTF or how much went towards FHPAP. And so we let the applicants make their own determination regarding what they felt they needed to effectively implement this program. And with this round of funding, there's much more service funding that's being provided, which includes staffing to support those households and the students in the school. And we actually have about 60% of our grant is for FHPAP funding. And so we're really looking forward to see, over time, if there's a difference between programs because of that additional element of intensive case management services being made available to the households. Next slide, please. So for households to be eligible, in addition to having or being a student at an eligible school, households for FHPAP must be at or below 200% of federal poverty guidelines. And then for HTF, a household income cannot exceed 60% of the area median income. Next slide, please. And eligible expenses encompass exactly what Erin and Diane covered, so I won't go too deep into that, but again, it's administration, support services, and the direct assistance that's available. Next slide, please, Erin. So with the 2018 funding, we funded 5 service areas that include St. Paul and Minneapolis, Beltrami and Cass counties, and West Central Minnesota. And then with the most recent funds, we funded 4 additional grantees. 2 of those do not have contracts executed, so I can't identify them, but they represent 1 each from the Metro and then 1 from Greater Minnesota. We also expanded the existing program in West Central Minnesota, and we also expanded our geographical area to include southeastern Minnesota, including the Owatonna, Mankato, and Rochester areas. Next slide, please. So you can find more information on Homework Starts with Home on our website. And we are also participating with the U of M's Grand Challenge program. And actually, Erin and Diane presented along with those partners last Friday at a conference. And so they're continuing to gather quantitative and some qualitative data and analyze that. So we're excited to see the impact that this program provides using evidence-based data. And are there any questions about Homework Starts with Home?
Thanks, Nancy. I'm going to pause just for a minute because I don't see anything that is very specific to Homework Starts with Home. So I want to just pause and see if there's any questions specific for that program or for Nancy. Okay, well, people are thinking, I'm going to jump to one back to the Family Homelessness Prevention and Assistance Program. A question about a funding increase and the impact of the funding increase to FHPAP.
Sure. So we did receive an increase to the FHPAP program for a little over $3 million just this past biennium, and we were able to award those funds out to our existing grantees. We had actually just awarded initial funds to them and were able to provide an increase for those grant administrators. The other impact that it had was we were able to increase the proportion that was being awarded to the tribal nations. One of the things that happened when tribal nations began participating with the program is that the funding amount was smaller than I think they could support a staff person for. So making sure that there was enough funding to support a staff person to operate the program. So that was one of the kind of impacts related to receiving the additional funds as well.
Thanks, Diane. So a question about, is it correct that Homework Starts with Home went from a pilot program to permanent program? And if so, was there a funding increase and or expansion?
That's correct. It actually did go into a program status due to legislative appropriation funding that we received in 2019. And so with this current funding, we did expand the existing program. And as I said, it's a little complicated to explain, so I apologize if I didn't explain it very well. We currently have essentially two programs running simultaneously, and eventually we will be down to just one program. So we will be issuing an RFP for Homework Starts with Home in early 2021. And that round of funding will be, it'll be 2 years effective July 1st, 2021 to 2023. And then after that time, we will just have one program that will be encompassing HTF and FHPAP. Our current allocated appropriation is $3.5 million. With this current round of funding, we did add some additional FHPAP funding that we had available, and that was in part why we were able to fund actually a fourth grantee, whereas without that funding, we likely would have been able to just fund 3.
Great. Thank you, Nancy. I'm getting a lot of great questions that are not program specific, more general, and going into the direction that we're going to next about just our programs in general. So the person who's submitting lots of good questions, I'm not ignoring you, but I want to save those good questions. Another one that came that's specific to Homework Starts with Home, is there a time limit to the rental subsidy provided?
With FHPAP, our average length of assistance is around 6 months, but it can go up to 24 months. And with HTF, it's generally, Erin, I might ask you to help a little bit with that. Because the program has an end date, generally that assistance would not go beyond the length of the grant term. And households, I would say, Erin, are averaging around a year of assistance in the Homework Starts with Home program utilizing HTF funding. Would you say that's accurate, Erin?
Yeah, right around there. I think depending on, as you said, like it's the grant term is kind of the bookends of the availability of rent assistance. So I think kind of with ramp up and the ramp down of a program, it's about 12 months. Oh, there's another Homework Starts with Home program question here. How are you identifying high priority homeless clients for Homework Starts with Home? Is it through coordinated entry referral?
It is. You have all households, while they may be identified at the school, in some cases, they do need to coordinate with the coordinated entry system and are prioritized accordingly.
Okay. I think that's it for program specific questions. I'm going to kick us off to our more of our discussion piece, and I'm going to start off with some poll questions. We'll start off easy. We'll start off light and easy and just talk more, get a sense of preferences about our request for proposal structure. So would you prefer an online application? And MCH folks, if you could launch that poll.
Erin, it says there may not be a poll. So I think this is maybe just a question. So you could just type in an answer to that, and we could go through the questions really quickly.
Okay. So there's not a chat feature for them to type it in. So let's just, or we can use the Q&A as a response section just to kind of hear from folks if that is a feature that creates some ease in applying for those who have applied with us or are interested in applying. Can you just type in the Q&A section if that is something that you like? I got one yes. As long as it's easy to navigate, there's a preference. It's nice to have it as an option. Capitalized with an exclamation point, yes. Okay, that's awesome. Okay, we'll go to another one. So we had another poll. I don't know if it's available. Would it work to have these resources pooled into one RFP instead of program specific? So, and if any of my teammates want to talk through that thought for people to be able to respond.
So I think one of the advantages that we see with some of the other state programs is when they're able to issue RFPs that include a multitude of resources. It helps with not having to respond to so many requests for proposals. It also gives you an opportunity to think about combining resources differently than they have been in the past. Homework Starts with Home is an example of partnering the FHPAP and Housing Trust Fund resources together. And we even had some philanthropy support for part of that as well. So just trying to figure out if like a combined RFP with more flexibility on how funding could be used would be a way that we could maybe utilize those resources better, or local communities could have more of the decision-making power on how those were used. So that's kind of the incentive for that question.
Great. So we did just a few questions here. I'm just going to scroll through them to help people kind of think about some of the questions that we're wondering about, and then I'm going to hand it off to Diane just to kind of frame this conversation, and then we'll go back to questions.
Great. And so I think even though we do want some feedback about the general RFP that we're issuing out now and how we might improve the process of how the RFP is working and so on, the thing that we really want to challenge you with is what our commissioner has been stating to us for over the past almost 2 years, which is go big so everyone can go home. And this was really an opportunity for all of us in our agency to be able to think about our programs completely differently than we've been thinking about them. And so we have an opportunity now to be able to hear from you on what we could do with the funding that we're receiving from the legislature, knowing that there are some statutory requirements with the funding that comes forward, realizing that everything is an open possibility. What are we able to do differently at the state that can make these resources easier to access? And so our next slide maybe gives an example. We really want it to be better for our grant administrators. We want it to be better for our clients. We want it to make sure that it's equity focused. And we've learned some lessons along the way related to this pandemic. An example is when we issued out the $100 million in funding, we tried to broaden the eligibility of that request for proposal to go beyond the usual administrators and see if we could solicit more culturally specific providers. And that was really important to us. So we met with culturally specific providers on the front end, and we tried to start working with a new tool out of the that has come out from the governor's office related to equity, so that you're doing your planning for your grant processes, including the voices of the people with lived experience and figuring out how you're going to pull that into your process. We figured out ways to streamline the process for applicants applying, that there's maybe more flexibility on their documentation that's needed, making sure that they can access the program using verbal signatures instead of written signatures, trying to make those program improvements along the way. And it's really challenging in a state agency to do that type of thing because, you have attorneys that you're working with and other folks at the state who are concerned about audits and fraud and, making sure that our programs have that trust that we need to be able to continue securing that funding. And so it's a real balancing act, but I think we have a huge opportunity with our commissioner to be thinking large. And so that's what I want to hear. I see there's a few questions that have been asked. I think it's from an anonymous attendee, but asking us about what we think about equity and what we think about including those voices of the folks who are actually impacted by our program. And yes, we're very interested in doing that. So we want to hear about how you do it, and we want to learn from that so that we can do it better as well. And I know, Ellie, you did that a little bit for Bridges. So can you describe sort of what you've been doing to give an example? But then I really want to hear from our audience on this.
Sure. The Bridges Rental Assistance Program, starting in the spring, was looking to expand the definition, as I explained earlier, of institution to include correctional facilities. So a group of Department of Corrections staff was formed into a work group. And we have a tool at Minnesota Housing that we've been using. It's an anti-racist tool. And that tool helped guide the conversations with the Department of Corrections staff to make sure that if we expanded the definition, that we were doing the referral process correctly, that we had culturally specific providers ready to receive people in housing, just to name a few things. But we really stripped down the program with this tool in order to include people who were justice involved into the program. In addition to the work group getting ready for the RFP, we also sat in on the tribal mental health initiative meetings, and then also sat in on the statewide meetings for organizations that are looking more specifically to serve the urban Indian population. So we've done outreach to those groups, and we're starting now to have those organizations reach back to us to help us design further the program elements to make sure that we are serving Indigenous groups. And then lastly, we paired up with the Olmsted team. They are working on their big 6 sort of strategic initiatives, and they have formed work groups of people who receive the services directly. So in the next 6 or 7 months, I think the work groups will be meeting, and these are, you know, people who receive the services that will be continuing to give us feedback on how to continue to shape the Bridges program to include people from an equity lens. So that's just a basic overview of how we've reached out and how people are giving us feedback. But we do welcome people to reach out, not only if they're interested in providing, whether they receive the services and want to give us feedback. Now, especially for Bridges, is a good time to do it as we're preparing for the next RFP round. Anybody have anything to add to that?
So there's a question about how do you use a strategic equity lens with and inside your programs, and I think that is actually what Ellie referred to, which is the anti-racist tool. And it, you know, it sounds like when you use a term like that, it almost sounds like a quick checklist, but I guarantee you it is not. It is very in depth. It has quite a few questions. Erin, you worked on it a little bit with our COVID-19 housing assistance program. How do you describe kind of the structure of that tool?
Yeah, so it is very discussion based, and starting with some internal questions about testing our own biases about who gets served, how they get served, who's successful, and engaging a series of external communication, which, you know, we had a shortened timeline with the COVID housing assistance program, but I mean, this is an example of a starting place of where we're asking these questions. And we have a community, I don't know her title, a person internally at Minnesota Housing who is working with external stakeholders and convening people, including people with lived experience of homelessness, and into these conversations in a meaningful way, and using this tool that asks really probing hard questions on us, and create some space to really hear that and find ways to implement them into our program. So it's conversation, it's long-term, it's ongoing. It's not just at the front end of an RFP, but it's a conversation that we're committed to have throughout the life cycle of our grants, and it really never ends. Good, important work. And there was a kind of coupled with that is a question I saw in here about engaging people with lived experience. I think in FHPAP advisory committees, that is a recommended and encouraged participant at that level, so that there's local input from people with lived experiences, and each advisory committee has a person from the state who is a participant in those local communities. So it is that is an access point that we have there, and we need to do a better job of that at the state level of engaging people with lived experiences. And I think we're on our way to do that. I think Ellie is doing an excellent job of engaging people directly, and invite your recommendations and how to do that better.
Yes, Erin, I would agree with you. This is Diane. I think this is where, if you have suggestions for how you've been able to engage the consumers for your programs, you know, we're a little bit removed from the consumer side, except for when consumers contact us about programs, which does happen quite frequently. we had hundreds of emails from constituents that were interested in the COVID-19 housing assistance program, for example, and we actually assigned 2 staff just to be able to respond to all of the emails we were receiving. I think that while we definitely hear from people on a regular basis, it's not the same thing as engaging those consumers in designing programs. And that's why I really appreciate what Ellie's striving to do with the current program that she is administering, because we need to do that more in all of our programs. And so we're going to be learning this along the way. And that's one of the reasons why we're just hoping you'll give us advice, even if you're typing it into the question and answer as not a question, but just simple ideas and examples of how you've been able to do that. That's going to really help us when we're designing these RFPs. And our RFPs that are potentially coming up are in the spring. And so we had initially talked about doing a combined process, but because the pandemic interrupted that, I don't think we're at a planning point to be able to do it. But we are at a point where we can start planning for the RFPs of the future. And certainly even the RFP that we issue in the spring, we want to have those opportunities to be able to engage our consumers before we issue that RFP. So it's got to happen soon. And that's part of the reason we're here, actually, even talking to you, is trying to figure out, what can you provide us with ideas so that we can move forward.
Yeah. So we have just a few minutes left. So if any of my teammates see questions in the queue that they are wanting to answer, there's kind of a mix of program specific questions at this point.
One of the questions that I wanted to highlight was a question about landlord engagement. One of the bigger pieces, Erin mentioned that we could have rental assistance, but we also need the housing stock that will receive that assistance. So Minnesota Housing as a whole has really taken a look at tenant screening practices in a different way. Back in 2019, Wilder Research released Criminal Background's Impact on Housing Success. And it's been an example set of research that we've been able to use with landlords, along with a lot of other initiatives that have happened across the state to really move the dial and how we talk about tenant screening practices. But Minnesota Housing as a whole has got an initiative at our senior level that's taking that to a new level with our multifamily developments. And I'm trying to, with Bridges, also encourage landlord engagement as a priority and tenant screening practices that match the participants that they're working with as a priority. So I intend through the next contract term to continue that conversation with our providers to make sure that we become experts in creating housing options for people with barriers to housing. So landlord engagement is definitely on our priority list at Minnesota Housing.
And Ellie, there was actually a question about what we're doing related to tenant screening. And so in the answered questions, you'll see a link that I put in to answer that specific question that also links to our tenant selection plan and the updated tenant selection plan, which is under review right now. It went out for like public comment, and now it's in the process of being finalized. And there's definitely more, kind of a reduction of the screening related to criminal history as part of that tool that folks will be able to use.
Great.
There is a question on here about rent assistance being short term, and a client that just needs assistance with 2 months of rent. In that circumstance, a program like the Family Homeless Prevention and Assistance Program could be a good option because it can provide a short-term amount of rent for somebody who needs assistance. So rather than, a long-term voucher being needed, if they just need assistance for a couple of months, that could be an option. And I also saw a question in the chat related to advocacy and what someone could do if they wanted to advocate with the legislature specific to programs. And so I think maybe someone from MCH can answer that one best.
Yeah, we would love for you to be engaged in our advocacy efforts throughout the session. If you sign up for our e-news, we will put out action alerts to the community when issues come up, and you can follow our legislative agenda and the policy change and the funding requests that we'll be pushing into the 2021 legislative session. So really just staying informed. Things happen so quickly at the legislature that sometimes you know, we need to take quick action. And so staying updated through our e-news and following us on our social media, as I pointed out at the beginning in the opening slides, those advocacy opportunities are really some great ways to get plugged in.
Great, thank you, Rhonda. Yes, I was going to save that question for last, just to plug your great work and the Homes for All campaign. Yes, and thank you for having us. Thank you for this opportunity to share about our programs. Please engage with us, continue the conversation. Shoot us an email whenever you think of a great idea or a challenge that you have administering the programs or serving the people that you work with directly. We will talk more often throughout, just to make sure that we're on the right path to serve Minnesotans in need and in housing crisis, serve them well and get them stabilized. That's a wrap, folks. Thank you so much. Any last words from my teammates?
Thanks, Erin, so much for facilitating, and thank you all for engaging with us. I hope that you do respond back to us via email on any ideas that you have, especially those ideas related to creating an equity lens within our organization for these programs. Thank you.
Thank you all.
Yep, thank you.
Well, yeah, thank you all for being here, for presenting, and then thank you to all of our participants for being engaged and bringing your passion to this work. We're really excited to be able to have this virtual learning series, so we hope this was really helpful to your work and to your community. I do want to plug our 11 o'clock session. We hope you'll join us back here at 11 o'clock, and we'll be talking with folks from the Office of Economic Opportunity and learning more about the shelter-linked mental health program with youth service providers. So we hope to see you soon. And again, thank you, Erin and your team.